answer this NGN practice question together. Hello everyone, it's Professor Mo from Rophem. We have a 34-year-old woman with hyperthyroidism. Patient weight is 107 pounds. The doctor wrote an order for large doses of radioactive iodine, 20 NCI. Which of the following nursing interventions is or are correct? Select all that apply. To answer this question, you will need to understand radioactive iodine. It can be ordered for the treatment of hyperthyroidism relating to Graves' disease. The thyroid gland will absorb the iodine isotope and the radiation will destroy overactive thyroid cells. Then you also need to be familiar with your nursing interventions. All of these will help you to select the correct answers. So we are going to take the answer choices one by one. Take a look at answer choice A. What do you think? Rule out pregnancy or breastfeeding. We must check to make sure the patient is not pregnant or breastfeeding. These are contraindications. Radioactive iodine is contraindicated in pregnant or nursing women because it can lead to complications in the fetus or in the baby. So that is very important. Then look at answer choice 2. Answer choice B. Monitor vital signs. What do we do with that? Yes, we need to monitor vital signs in this patient after receiving radioactive iodine treatment. This is not like doing general check on every one of your patients, but this one, we are doing it so that we can rule out or we can assess for thyroid crisis. Then look at answer choice C. C is also correct. Okay, the patient must be observed for signs of thyroid crisis. In this case, it is because radiation-induced thyroiditis can lead to thyroid crisis. Answer choice D says to restrict fluid intake. So why do we need to do that? D is incorrect. You know why? We don't need to restrict fluid intake. It will be very important to actually increase fluid intake. We need to flush out the excess radioactive iodine, and that is going to be done through the kidneys, and fluid intake will help with that. Take a look at answer choice E, undo contaminated materials properly. Answer choice E is correct. The radioactive material is removed from the body through the kidneys. So, as a nurse, you must be very careful to undo contaminated equipment properly. For example, specimen containers and bedpan. Because why? They are likely to be contaminated with urine from a patient who has received radioactive iodine. Take a look at answer choice F, encourage increased activity. Well, increased physical activities will not affect the procedure for this treatment. Let's go to question 2. 6 months later, a thyroidectomy was done. After surgery, patient complains of serious muscle twitching and cramping. The following orders were written. You will need to place the nursing actions in the order of priority. So take a look at all of the choices. What do you think? Here is what you need to remember. Whenever thyroidectomy is done, there is a possibility that accidental removal of the parathyroid gland can happen during surgery. PTH is needed for calcium regulation. Accidental removal of the parathyroid gland will lead to hypocalcemia. So take a look at the patient complaint. Those are signs of hypocalcemia. And that's where the problem started and must be corrected first. So calcium gluconate should be administered first to correct the deficiency. That will be our number 1. Which one do you think should be the next? Changes in calcium level can cause dysrhythmia. So cardiac monitoring should be implemented next. That will be our number 2. What do you think will be number 3? If the calcium levels keep going down, it can lead to seizures. So we will need to put seizure precaution in place. But here's the thing. Administration of calcium can prevent the cardiac dysrhythmia and the seizures. So we will need to do the calcium first. The last one to do here is to request for high calcium diet. That also will help us to maintain calcium levels for this patient. Thank you so much for watching and learning from this video. Like, subscribe, and follow this channel to stay updated. If you have any questions, you can drop them in the comment section. See you next time.